Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Angina. Introduction. Angina is pain in the chest and surrounding areas of the body that happens when the heart does not get enough oxygen. Angina is also called angina-pectoris. Pectoris is Latin for chest. Millions of people suffer from angina. Knowing how to recognize and prevent angina can mean the difference between life and death. This program will help you learn about the signs of angina, what causes it, treatment options, and how to prevent the serious diseases that it may be a sign of. Symptoms. Most patients feel severe chest pain or pressure during angina. This pain can spread to the arms, neck, back, and jaw. Some people feel indigestion and nausea. Angina may cause a feeling of heaviness or tightness in the arms, elbows, and wrists, mainly on the left side. Fatigue and shortness of breath could also be a sign of angina. Angina pectoris usually happens when a person exerts a lot of physical effort for a few minutes. It goes away when the person rests or takes medication. Sometimes it can happen at rest. Anatomy. The heart is responsible for pumping blood to all the organs in the body. It is a highly specialized muscle that is expected to work continuously, without rest, for a lifetime. The heart is divided into the right and the left sides. Each side has two chambers, the atrium and the ventricle. Special valves that prevent blood from flowing backward divide the chambers. Blood loaded with oxygen comes from the lung and enters the left atrium. It stays there until the mitral valve opens up and the atrium contracts. This forces the blood into the left ventricle. The blood is then pumped to the rest of the body through the aortic valve into the biggest blood vessel of the body, the aorta. After the blood comes back from circulating through the body, it goes into the right atrium. From there, it is pumped into the right ventricle through the tricuspid valve, and then to the lung through the pulmonic valve. In the lung, the blood picks up oxygen and returns to the left atrium, where the whole cycle starts again. The heart needs a continuous supply of oxygen and sugar to be able to function. Oxygen-rich blood is delivered to the heart through the coronary arteries. These arteries branch off from the aorta. The heart contracts automatically in a very coordinated way. Special cells located in the atrium set off the electric current needed to cause the atrium to contract. The electric current spreads to the ventricles through specialized cells. This causes the ventricles to contract after the atrium does. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. Angina is a sign of coronary artery disease. Coronary artery disease develops if the blood vessels that carry oxygen to the heart are clogged. Fatty materials called plaque can narrow the blood vessels of the heart. This is called atherosclerosis. Atherosclerosis can cause decreased blood flow and oxygen to the heart muscle. This is called ischemia. Angina is one of the symptoms of ischemia. The earlier it is discovered and treated, the better are the chances of recovery. Angina can happen due to other conditions that may affect the way blood flows to the heart. Abnormal heart valves, abnormal heart rhythms, and anemia can all lead to angina. Angina versus heart attack. Sometimes a heart artery becomes completely blocked by plaque or blood clots. When this happens, blood flow to that part of the heart stops. Without blood, the cells of the affected heart muscle will become permanently damaged. This is what happens during a heart attack. The signs of a heart attack are similar to those of angina with three main differences. 1. The pain is more severe. 2. The pain usually lasts longer than 5 minutes. 3. Medication or rest does not relieve the pain. Healthcare providers refer to angina preceding a heart attack as unstable angina. On the other hand, stable angina refers to chest pain that is not pain before a heart attack. When you feel chest pain that is not yet diagnosed by a doctor as stable angina, you need to seek immediate medical help to determine if your angina is unstable, that is a precursor to a heart attack. Diagnosis. To help determine the cause of chest pain and discomfort, the healthcare providers will first take a medical history and do a physical exam. To determine if the patient has angina, the healthcare provider may do several tests. An electrocardiogram, or EKG, is used to record heart rhythms. An EKG is pain-free and has no complications. A stress EKG may also be done. During this test, the patient is asked to exercise on a treadmill or a bicycle while an EKG is being taken. Changes in the EKG pattern help the healthcare provider determine if the patient has coronary artery disease. Complications are rare during a stress EKG. The exercise you may be asked to do could cause angina. If this happens, you should inform the healthcare provider during the test. If any problems would arise, immediate treatment is always available. Patients who cannot exercise may be given a medication to cause the heart to beat faster. This medication helps to simulate exercising. An echocardiogram is another test that measures the structure and function of the heart. The healthcare provider analyzes images of the heart function on a screen. The echocardiogram is also typically painless. Another test, called a nuclear scan, is used to study heart function. A small amount of radioactive material is injected into a vein and a camera takes pictures of the heart. The parts of the heart that are not getting enough oxygen show up in the picture. If initial tests show that there may be blockage in the blood vessels of the heart, the healthcare provider may recommend angiography. During an angiography, the healthcare provider inserts a thin tube, called a catheter, into an artery in the groin or arm. The catheter is guided to the heart and dye is injected into the coronary arteries. X-ray images are then taken, which can show blocked heart arteries. Angiography requires local anesthesia and is usually an outpatient procedure, which means you may be able to go home after the test is completed. Because of the different types of angina and heart diseases, it is important to check with your healthcare provider when you feel chest pain to find out what is causing it. Treatment options. If you have angina, your healthcare provider may prescribe one or more medications to relieve the pain. Some medications work by increasing blood flow to the heart, while others decrease the heart's demand for oxygen. If not treated, stable angina could lead to a heart attack in the long run. Nitroglycerin can prevent or stop angina by causing blood vessels to relax. This increases blood flow to the heart and reduces the amount of work the heart needs to do. Nitroglycerin can be taken as a tablet, patch, or ointment. Be sure you understand the instructions on how to take or apply nitroglycerin. Other drugs decrease the blood pressure and heart rate, thus decreasing the demand for oxygen. Examples of these are beta blockers and calcium channel blockers. Drugs can prevent the pain associated with angina, but they do not treat the underlying disease of the blood vessels in the heart. If you have coronary artery disease, you can prevent it from getting worse by choosing a healthier lifestyle. External counterpulsation, ECP. With ECP, blood pressure type cuffs are placed around the calves, thighs, and pelvis to increase blood flow to the heart. ECP requires multiple treatment sessions. The American College of Cardiology, American Heart Association, and other heart organizations say ECP may help reduce symptoms in people with refractory angina. Your healthcare provider may recommend surgery if the blockage of your heart arteries is severe or if medication does not help. During a surgical procedure, the healthcare provider may push the plaque against the walls of arteries. Remove the plaque. Bypass the arteries filled with plaque by using a blood vessel from your leg. Nitroglycerin. Nitroglycerin tablets are used for fast relief from angina pain. If your healthcare provider prescribes nitroglycerin for you, follow the steps described on the next few pages when you have angina. Sit down and rest. If the pain persists, place one tablet under your tongue and let it dissolve completely. The tablet will not work as fast if you swallow it. If you still have chest pain after 5 minutes, call 911. You may be having a heart attack. The emergency personnel may ask you to take an aspirin if you do not have any contraindications. Remember to call 911 before you call a friend or a family member. Your healthcare provider may give you more specific instructions about your medications. You may be prescribed a spray instead of a tablet, or your healthcare provider may recommend different steps than this program describes. Preventing angina. Medications and surgery do not cure coronary artery disease. If healthy lifestyle changes are not made, the blockage of the artery will become even worse until it causes a heart attack that could be fatal. The following are the 10 most important tips for living a healthier lifestyle that can improve the health of your heart. 1. Do not smoke. 2. Be physically active under your healthcare provider's supervision. 3. Eat a healthy, balanced diet. 4. Check the level of cholesterol in your blood. If it is high, get it under control. 5. Check your blood pressure regularly. If it is high, keep it under control. 6. Lose weight if you are overweight. 7. Exercise regularly. 8. Check the level of sugar in your blood. Keep it under control according to the guidance of your physician. 9. Get enough sleep at night. 10. Manage stress in your life. If you have angina or other heart diseases, talk with your healthcare provider before starting an exercise program or a weight loss program. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Coronary artery disease is the most common cause of death in the United States, and angina is one of the most common symptoms of this disease. If not treated, blockage of the coronary artery could become more severe, leading to a heart attack that could be fatal. It is important to learn the difference between the signs of a heart attack and angina. A heart attack should be treated immediately by calling 911 for emergency. Medications are available to relieve the pain of angina, but to control coronary artery disease, medications and surgeries may be needed. Most importantly, healthy lifestyle habits should be followed. Thank you for using Explain.